Hi everyone, welcome back to my YouTube channel. Today we are going to talk about occipital bone, and here at the side you can see the diagrammatic representation of occipital bone showing different parts of occipital bone. So let's start our topic with the introduction. Occipital bone is a large singular bone that is located at posterior and inferior part of skull. It forms the back of cranium, the base of skull. It is the posterior cranial fossa which houses the cerebellum and parts of brainstem. It plays a crucial role in protecting the brain, connecting the skull to the spine, and providing passage for key neurovascular structures. Now let's talk about anatomical parts of occipital bone. It has squamous part that is posterior portion, basilar part that is anterior to the foramen magnum, lateral part that are the condylar parts. Now let's talk about these anatomical parts one by one. First, it has squamous part that is posterior portion. It is broad and curved. It forms a visible back of head. They are externally marked by external occipital protuberance that is a bony bump often palpable at the back of skull. Radiating from this bump is a superior nuchal line that is a ridge for muscle attachment. On the internal surface you will find the internal occipital protuberance and groove for venous sinuses. Next anatomical part of occipital bone is basilar part that is present anterior to the foramen magnum. It extends forward to join with the sphenoid bone. Internally it supports a part of brainstem and externally contributes to the cleavage, that is a slope leading to the foramen magnum. Next anatomical part of occipital bone is lateral parts that are condylar parts. They are located on either side of foramen magnum. They feature the occipital condyles which articulate with the first cervical vertebra, that is atlas, forming the atlanto-occipital joint. This joint allows nodding movement or the jest movement of the head. Now let's talk about key foramens that are present in the occipital bone. They have foramen magnum, that is the largest opening in the skull. It transmits the medulla oblongata, meninges, vertebral arteries, spinal accessory nerve, and associated structures. The next foramen is hypoglossal canal, that is located near each occipital condyle, and it allows passage of hypoglossal nerve, that is cranial nerve number 7, which controls 12, which controls the tongue movement. Now let's talk about articulations of occipital bone. Occipital bone interferes with six bones. Parietal bone, as it interferes with the parietal bone, articulates with the parietal bone superiorly through the lambdoid suture. It also articulates with the temporal bone laterally. It articulates with the sphenoid bone anteriorly and atlas, that is C1 vertebra, through the occipital condyles. Now let's talk about development and ossification of occipital bone. It develops from four ossification centers: one basilar ossification center, two lateral ossification center, and one squamous ossification center. These centers fuse during early childhood. Complete fusion of all parts is usually achieved by age 6. Further talking about clinical significance, we know there is basilar skull fracture. That is when there is involvement of occipital bone. It can affect critical neurovascular structures and are often serious. Next clinical significance is occipital neuralgia. That is sharp pain in the back of head. It can arise from irritation or injury to the occipital nerve passing near the bone. Next clinical significance is foramen magnum. That is region is of great surgical interest due to its role in brainstem and spinal cord passage. Now let's talk about conclusion of this lecture video. From the elegant curvature of nuchal lines to the critical gateway of the foramen magnum, the occipital bone is a blend of strength and function. It is not just the foundation of your skull, it is architectural keystone linking brain and spine, vision and movement. And this was all about occipital bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.